Welcome to the Student Sector Spotlight podcast, brought to you by the Humber Outreach Programme.
Welcome back, anyone who's listening or watching this, our next episode of the Student Sector Spotlight podcast. And today I have the privilege of speaking to Dr Mat Fortnam. What is your actual job role and what do you do within Haxby, and who are Haxby as well?
Sure. Thanks very much, Rachel. So, my name is Dr Mat Fortnam. I'm a GP by profession, and my role within Haxby Group, who are a GP practice provider, is I'm a GP partner, which basically means I co-own the actual running of the business and work with my other partners to employ the rest of the staff, as well as deliver the services that we would normally run in a GP surgery and sort of manage the business, really. I'm also one of the directors in the business group as well.
How is your role divided?
Yeah, so good question. So about 70% of my role is seeing patients, I would suggest, and the 30% that's left is either sort of divided up into running the business, but also helping run our training company, which we have as a sort of subsidiary business alongside the main core business. So that basically means that we own a couple of other things or other companies within our core business of seeing the patients, which helps support the running of the overall business that is our operation.
So this might be me being how does the actual business work then?
So in the UK, certainly in England, the majority of GP practices are actually owned by the GPs themselves, or some of the GPs themselves. And therefore they would take on the ownership of running the business, and they contract with the NHS, which then pays them some to run a contract to see patients and for a set amount of money. And from that amount of money, we then have to sort of employ the staff, pay the heating bills, pay the water bill, and have some money left over to pay ourselves an annual salary, if that makes sense. So that's how it works. And I'm not sure that's well understood really by the public in the main. So we're not actually, I don't formally work for the NHS, so I'm not contracted by the NHS, although we run NHS services. So I feel as though I kind of work for the NHS in a way, because we're all part of the same system, but actually technically I'm self-employed. So my employment, I'm a partner and therefore self-employed, and therefore the NHS kind of contracts with me and my colleagues to run the business. So some of the doctors that you'll see if you go to the doctor's surgery may well be partners. They may own the business. Some may be salary GPs. They may work as a contracted employee of that business, and some may be locum. So they may be self-employed but work in a few different surgeries. So the people that you see may have different roles within the core business that you actually go into the surgery to see. The majority of GPs who end up as partners, or who end up involved in the running of the business, will have some experience of being a GP within that business first, to get experience and to sort of know that it's the right fit for them, but also the business is the right fit for the business too. And then over time, usually there's a mutual discussion and interview process to then become part of the partnership. But partnership is only one way of working the GP, and there's lots of GPs who do great jobs working in other fields, even maybe work out of a surgery. They may work in maybe the hospital or out of our setting, like a walk-in clinic. So this is just one way of working to GP, which is the traditional model of owning the practice and then employing the rest of the staff that work in there.
So how long have you been a GP for then?
Just over 5 years, so 5 years, 3 months. I qualified in 2018 and I took up partnership in April 2020, just at the start of the pandemic, which was an interesting way to start my career as a partner.
Did you say that there's training provided as well through the business?
Yeah, so we're also a provider of training courses locally, mainly for other surgeries, and we also host a contract which helps us deliver workforce initiatives to different healthcare professionals across the region for Humber and North Yorkshire. So we're quite sort of entwined really in the local infrastructure of primary care, mainly to do with our training arm.
So your pathway to where you are now then, I'm guessing, I could be wrong, you've gone through GCSEs, A-levels, university?
Yeah, that's correct. Yeah. So to qualify as a medic or a doctor in the UK, you would have to obviously do GCSEs and A-level, which would have to include science. So I've got a slightly unusual route in the fact that I didn't do science A-levels originally. So I did psychology, PE, history and English, because I wasn't really interested in medicine when I was about 16, 17. I wanted to be a footballer. If I wasn't to be a footballer, I was going to teach history. And then I got to university, I did sports science at Loughborough and decided actually, I'm not sure it's really for me. I quite like human biology and I quite like sport. And I had a bit of an epiphany where I thought, actually, you know what, I actually quite like applying this sort of knowledge, but actually dealing with people. And someone actually came up to me and said, have you ever thought of medicine? And I thought, oh, not really, because none of my family were medics. So I decided, not on a whim, but after a bit of discussion, to sort of follow that and go back to sixth form college to do my biology and chemistry at A-level. So most medical school universities would want biology and chemistry as a prerequisite at A-level. Now, we obviously employ lots of other people in the surgery, nurses, healthcare assistants, admin roles, managerial roles, other doctors. So all the routes into those roles are slightly different, and the prerequisites in terms of the GCSEs are going to be different for each role. But for a medic, GCSEs, A-levels, and then a university would have to be, undergraduate medical degree would have to be completed. And beyond that, usually it would be then 2 years of foundation training as a doctor working in hospitals in the UK, and then 3 years on a GP to a training scheme. Now, many of my colleagues will have worked more qualified primarily abroad, and they will come into the UK and maybe have to go through a different training route. But from a UK graduate's perspective, that's what we would commonly go through. So in total, from the start of medical school to GP, the minimum is 10 years at the moment.
So your undergraduate's 5 years?
Yeah, that's correct.
Then your medical, what's it called?
So after that, so you do 5 years of medical school, and then you start as a doctor, as what we call a foundation year 1 doctor, and you rotate doing different things within hospitals. So you might work 4 months working in A&E, you might do 4 months working in paediatrics, 4 months working in ENT, for instance, and then you do 2 years of that overall. Yep. And that gives you the experience to then apply to become a specialist in any given speciality. So I could have chosen to work as a radiologist or a surgeon or a medic in hospital, but I chose to work as a GP, and the training schemes at different lengths and are made up differently according to which speciality that you choose. So I chose general practice, and that's a 3-year training scheme after you've done 2 years in hospital.
So depending on the specialism that you pick, presumably that is different for each person.
The other thing is, obviously, from the moment you qualify and you work as a doctor, you do get paid. So although you're still within training, you're in a training post, you are in employment, you do receive a salary. People maybe refer to junior doctor. You might hear that term sometimes. That's anyone below the level of a specialist or a GP. So it's foundation doctor, core trainee, registrar. These are all terms, but that's what that means.
Did you enjoy getting to kind of try being on different wards and things, like when you was going through that process, and why did you pick being a GP over something else?
It's a good question, and I think actually this is the main reason I wanted to become a GP. The more that I experienced, the more that the more I realised I quite enjoyed doing a bit of everything. Didn't really feel that I really sort of fell within a particular speciality, and I quite like the breadth of doing bits and bobs from each of them and not losing any of that skill or knowledge. The body which sets our professional standards, the Royal College of GP, the motto in Latin, I think, is something like Cum Scientia Caritas, which basically translates to via scientific knowledge delivering with compassion. So the kind of mixture of the scientific knowledge, but mixing it with speaking to people and being there for people. So that's again why I chose medicine, but also particularly general practice, because you'll get very quickly from me, I like talking. So GP is a good talking speciality, but it's also a speciality where you can apply lots of what you've learned, but doing it via sort of giving or being compassionate. I think that's a really important part of our job.
Yes, so you qualified as a GP and you were hired as a GP through Haxby, and then became a director, one of the directors of Haxby.
Yes.
Is that correct?
Yes, correct. Yeah.
That's more for me than any students listening. I'm trying to get my head around it.
It is, there's a lot that happens beneath the surface of medicine and general practice, which is quite sort of unique and old-fashioned, and the general public may not necessarily know all the ins and outs of it, which I think is reasonable, because there's so much to learn. Even as a GP, I'm still learning all the time about how the system all works and pieces together. The crux of it is that general practice in the UK is funded via the NHS. The NHS funds it, and then we will then carry out the delivery of that contract as GPs or GP partners and hire the staff according to the need of the population that we serve.
So do a lot of GPs that are hired, do a lot of them strive to become directors within those organisations, or is that just something you wanted to do?
Historically, that was more the traditional route, is that people either aspired or basically worked as partners because that was the traditional model of delivery. Over time, because working patterns have changed and potentially the financial buy-in is more because the properties have become more expensive, because often you don't normally have to buy in to buy a proportion of the properties that you would actually own. You need a capital buy-in to actually own the business. So financial ties, maybe a concept of inflexibility, because people might perceive that they want to do different roles. Maybe they want to do a bit of teaching, or they want to do research, or other roles within healthcare. They felt that maybe working as a sort of a part-time or a part sessional GP, so they maybe work GP some of the days and they teach some of the days, was more beneficial to them. There's also been an increase in workload, I guess. So becoming a GP now, comparatively to 20 years ago, we have more patients per GP in the UK than we did. So the amount of workload that's coming to an individual GP has increased over the course of time as people are living longer, living with multiple long-term conditions, and the workforce in general practice has actually become stagnant, or in some areas reduced. So we're kind of doing more with less. We have had additional support from other roles that are new to general practice, but that's just a bit of an overview of kind of why the traditional partnership model is just changing slightly. And in some areas it's completely dissolved. You'll have hospitals that actually run some of the surgeries and will actually own them as trusts. But that, again, that's getting into the niche, really.
Yeah, I guess it depends on the person and what they're interested in and what they want to do.
Yeah. And there's no differentiation. Becoming a partner shouldn't really be seen as anything more aspirational than becoming a sessional or a salary GP or as a locum. We're all professionals in it together, and hopefully each role comes with its own pro and con, which reflects your skill set and what you want to get out of. I want to become a partner because primarily I want to have a bit more say in what happens and a bit more ownership and a bit more direction. I quite like that kind of aspect of my role. Whereas other people, that might not be something that suits them quite so much. So that's the nuts of it.
For any students that are listening to this, if we start with the GCSEs, is there anything that you think is valuable?
Yeah, it's difficult to be prescriptive because I would always sort of encourage people to do with what they enjoy the most. I think you maybe have an idea about what you want to do, but things can change. And certainly from my experience, what I wanted to do at 15, 16 changed when I became 18, as I just became a bit older and learned more about myself. And perhaps I underestimated quite a little bit about my own ability, because I didn't think I was particularly academically strong when I was at secondary school. I did really well at my A-levels, and then almost a bit sort of shocked myself as to, okay, well, maybe I could do something else. So yeah, for medicine, certainly science A-levels, I was always quite interested in history and English. So I did those, but it's difficult to be prescriptive. So I think the most important thing is doing something or a subject that you're passionate about and you feel that you're going to enjoy the actual subject, because learning about something or doing something that you don't enjoy or find interesting becomes more of a burden, I think.
And obviously with your process, we talked about the university route, which I'm sure students will be aware of. Is that the only route, or is there any other ways in?
Well, it depends what you're thinking about in terms of the roles within healthcare, really. So certainly in our organisation, we're quite a large scale GP provider. It basically means we have about 100,000 patients across 3 different areas, so Hull, Scarborough and York, which I think last count, probably about 11 surgeries. And we probably have about 450 employees. So it's quite a big operation. And so therefore we employ lots of different staff, and they come through loads of different routes. So yes, some will be regulated professional healthcare workers. So those would generally have to go to university to obtain an undergraduate degree, some degree of postgraduate training. Some will become through an apprenticeship route. So for instance, healthcare assistants who aren't regulated by the Nursing Council, and increasingly there's a new role called the Nursing Associate role, the Trainee Nurse Associate role, which is kind of bridging the gap between healthcare assistants and nurses. So these roles traditionally won't need to go to university. They would learn on the job with a very descriptive training program. And other roles in the team, so we have administrators or managers. We've got people in quite senior management positions now that originally started as an apprentice. So we definitely are very keen to employ apprentices, upskill them as they go along their career. And there might need to be, if they were going to go into a more senior management position, a desire to then take a degree in older sort of career stage. But yeah, so it depends on the role that you're going to have in the team as to what qualifications you're needed. And some will need a formal undergraduate degree to sort of badge against have that professional status, which is a regulated body, and some won't. There has been talk actually of even medics going through an apprenticeship route. So one of the newer thoughts is actually, do doctors need an undergraduate program? Can they learn on the job over the course of 5 years and have more of an apprenticeship type of role? And that's not yet been fully formalised, but is kind of happened. The wheels are already turning on that to sort of make it potentially happen over the course of the next sort of 5-10 years.
You've obviously mentioned that you have apprentices come through for
Yes.
different kinds of roles. Do you do any degree apprenticeships?
So we have some roles in the team where they'll be in a university that they'll be supporting an apprenticeship. So, for instance, our trainee ACPs who have generally had an undergraduate degree in something else, but are now working to become an advanced clinical practitioner, will be affiliated with the university, but they'll be funded via an apprenticeship route. So that's like a degree apprenticeship.
If a student was wanting to look into any vacancies for apprenticeships at Haxby, where would they find that?
I would hope there is the information on our website.
Yeah.
So Haxby Group is our website. We're obviously just one provider of healthcare in this region. There are lots of others. So other GP practices, other sort of trusts that exist in this region. And, you know, as much as I'm here sort of talking about my role in my business, I'm very keen that healthcare in general is something that we all need to be interested in, because I'm a doctor, but I'm also a patient. My family are also patients. And if we don't think about healthcare as a really enjoyable, sustainable career, the next generation of people that need, so when I'm in my 60s or 70s and 80s, I want to be looked after as well as I'm trying to look after the generation I'm looking after now. Does that make sense? So I really am passionate about making sure that the next generation feel as though healthcare is something they want to step into, regardless of what they do, whether it's working as a frontline professional or working alongside them and sort of supporting them in that.
Yeah, you can see how passionate you are. It's good. It's really good to see. Okay, so in terms of we've gone through uni, we've gone through everything, we graduated, we're a GP. How do we apply as a GP specifically? Not really your other roles that you've mentioned, but what's the process?
The majority is pretty much like any other job. So usually a practice will put a notice of vacancy or vacancy notice, and they'll usually put it in the BMJ, the British Medical Journal. They might sort of email it to local groups to advertise. There's also online areas where you would look. BMJ Careers is another one. So there's loads of different avenues to find jobs that way. A lot of what happens is people, obviously, when you're training, you're working in a surgery as a GP, getting paid as what we call a registrar, and you're working alongside your colleagues, and they'll often sort of say, well, you know, you're working quite well with us. Have you thought about working when you qualify with us on a full-time basis or a part-time basis? So jobs often can happen almost naturally, if that makes sense. So it kind of naturally progresses, and that probably negates the need to go through all the formal interview process. You might want more of an informal interview process and just the sort of HR stuff to do that. But yeah, so the premise is very similar. So usually it's a CV that would need to be handed over, and often a letter of good standing or a sort of cover letter from a previous employer or someone that's been involved with your training. And you'll also, before you start work as a GP, you'd have to actually get your certificate of completion of your training, and you apply for a place on the GP register, which is something separate that the GMC hold, the General Medical Council, that's a professional regulator. The premise really is that it's a similar sort of thing to any other job, really. It's a vacancy that's applied for, and the number of applicants per job now is probably less than it used to be, and lots of registrars coming off the scheme are finding jobs relatively quickly, because there's always more work out there really than there is capacity at the moment to give, because we're always short of workforce at the moment. The number of patients coming in needing our support is greater than our capacity.
And it would be an interview as normal? Yeah,
the majority of cases. I think maybe the people that have been working in that surgery as a trainee, they may not necessarily need the formal interview process. The majority of people will go through some form of interview, some of it might be structured, and then you'll be offered a post if you're successful.
They're not putting you through any tests or anything, because you've got that training, you've got that certificate.
Yeah, so So the examinations, obviously, to become a GP, you have to pass 2 exams. And then before you get to that point, as you pass your undergraduate degree, exams again to pass that stage. And before you get to medical school, there are what they call aptitude tests, which kind of try and define aptitude to sort of problem solve, which I think increases or decreases your score when you actually apply to universities for medical degrees. It increases or decreases your sort of likelihood of you getting your first choice, I guess. If working in healthcare interests you, be inquisitive. You know, if you know someone who works in a surgery, ask them whether you can maybe even spend some time shadowing. A lot of our medical students that we sometimes have in our surgery or know us will sometimes come to work for us in the summer between university years, so between first and second year, and they'll just get experience working in the surgery doing some admin or coding, which it gets them used to the kind of the mechanics of working in a practice surgery.
Yep.
So again, we're very much keen to sort of work with anyone that wants to have a career in healthcare, regardless of whether they want to be a doctor, a nurse, an admin, a manager. There's a career for you in a GP setting, regardless of really what your skill set is. But of course, there's lots of other careers in healthcare. And as much as I want to sort of sell the dream to work for us, this is about trying to sort of make sure that we've got the right skill mix in the workforce to sustain healthcare delivery going forward for the next sort of 20, 30 years.
For anybody listening and watching, Matt's information will be underneath in the description, as well as the Haxby Group info as well. So that's great. Thank you so much for giving your time up to talk to me today.
No, it's a pleasure.